we're now going to have Ms. Debbie Forward, President of the Registered Nurses Union of Newfoundland and Labrador. And I'll just get your presentation up. Just give me.
Well, good morning, everyone. And I want to thank the organizers for inviting me to participate and speak on behalf of registered nurses in Newfoundland and Labrador. My presentation is called Registered Nurses Know, Solutions That Make Sense. And how do we improve costs, health outcomes, and costs? That's the, I don't know how many $1 million question today. $3 billion question, I guess. That term has been bandied about a lot. And there are many solutions and strategies and perspectives. There is absolutely no magic bullet. And if we think there's a magic bullet, those that think that, you might as well just leave the room now, because the healthcare system is very complex. So there is not one solution. One size does not fit all, which is why I think there's a compilation of people in the room today. We've already heard many ideas. My focus today is going to be on the perspective of registered nurses and the role that registered nurses can play in terms of improvements in our healthcare system, both in terms of cost and in terms of patient outcomes. RNU represents about 5,200 registered nurses in Newfoundland and Labrador. We're the largest group of healthcare providers. The largest group. We work 24 hours a day, 7 days a week in settings, all settings in our healthcare system. And I know today is a little bit about stirring the pot, so I'm going to stir the pot a little times in my presentation. And when I looked at the lineup, I certainly, when Wade called me and said, do you want to do this? I mean, I didn't hesitate half a breath. Said, absolutely, we'll be there. But when I looked at the lineup, I have to say that the healthcare system is about more than doctors. I'm the lone voice for registered nurses, even though others have addressed registered nurses in their presentations. I know pharmacists are here, but I think as we move forward, we need to be a bit more inclusive, because everyone or one provider doesn't have all the answers. I don't profess to have all the answers for sure. What I present today aren't the only solutions. You got 30 minutes, and I've just probably taken a minute longer than I know I'm supposed to be on this slide. So you have 30 minutes, and you can't say it all in 30 minutes. It's impossible, and certainly in terms of giving background. But I do believe, as we move into change in the healthcare system, it's absolutely imperative that you consider the voice of the people who are in the system night and day, who are there on the weekend at 3 a.m. in the morning when there are no physicians, there are no pharmacists, social workers, or anyone else. It is nurses, whether it be registered nurses or licensed practical nurses, who know what's happening at that hour of the day. It's the registered nurse in small rural communities, those facilities that we put on the board, you know, in Harbour Breton and Burgeo. It's the one lone registered nurse who's in that facility, who is deciding in terms of physician callback or not. We have to listen to those registered nurses and those nursing voices as we move forward. So why are we in this situation, and why does healthcare in this province cost so much? I'm not going to spend a whole lot of time on this slide because a number of people have talked about it, but we have to consider the high rates of obesity, heart disease, stroke. We've talked about that, and the poor outcomes that we have, our large landmass and the cost associated with that, and our aging population. Those are realities. The reasons why we have that many health facilities is because we're freaking huge, right? And that is a reality. And we're also very, very sick, very sick. And I think the point made by Dr. Parfrey a minute ago about we want to transform the system to be healthier, social determinants of health. Here, I'm in as a registered nurse. And registered nurses, we're all in on that. But we're not going to get there overnight. And in the meantime, we have to provide health services to very sick people in our province. So we need to get on a healthier path, and we need to make our population and our healthcare system healthier and have our futures healthier than what they are today. But going down that path is going to take time, as I said. So the first half of my presentation is going to focus on how we get there, how we get to that healthier path, to a healthier population and what registered nurses can do in that. Primary health care, strengthening primary health care is key. Others have talked about this. When I heard Minister Haggie this morning in his presentation, I sort of sat there and gave my head a shake because we sounded a bit alike. And he would be the first to say that a lot of times we don't sound alike, but there's certainly, today we're in sync on a lot of things. I applaud government for their initiatives and the way forward about primary health care and the move. It needs to happen fast as we can make it, but I also understand there's restraints around that. We need to be realistic. But I've also been here many, many times before. And you know, nursing unions and the nurses union in this province is probably, or I feel, is the most progressive union in this province and across the country. And it was the nurses union who brought forward a concept to government in the early 1990s about community health centres that were all focused on primary health care, using a wide variety of providers depending and care provided based on population need. That was in 1990. We're in 2018 and we're talking about a primary health care model that is the same. And I feel like primary health care has done this and done this, and this. We say we're all in, and then it falls off the plate because more important issues come. We're all in again, and it falls off the plate because more important issues come. Well, that's why we've got that really unhealthy population, because we let it fall off our plate. Please do not let it fall off our plate again. RNs, and we believe that the team has a standard core team. You need a physician. You need a nurse practitioner. You need a registered nurse. And with our population, you need a social worker. That's your core of a primary healthcare team. Then you add providers based on needs of the community. It might be bigger than that. You might need to add the second nurse practitioner or the second physician, depending on the needs. And the RN in that team needs to be the patient coordinator. They need to be the person when that patient comes in the door to decide who do they need to see. The gatekeeper of that team should not be a physician. The physician shouldn't decide and take the time to say, you don't need to see me, you can go see a nurse practitioner, or you know what, you really need to talk to a social worker because your needs are in that area. That can be the role of a registered nurse. Nurse practitioners. We have about 132 practicing our province today. We know they're a valuable resource in urban and rural areas, in acute care and long-term care. We know the evidence is there in terms of the value of nurse practitioners in the system. It's time for us to focus more healthcare dollars so that regional health authorities can put nurse practitioners in areas where we currently don't have them. It's also time for us to look at a payment model where nurse practitioner-led clinics can be funded under a public system so that if I choose to have a nurse practitioner as my primary healthcare provider, that I don't have to pay out of my pocket to do that. I can go see my family doctor. It doesn't cost me anything. Why should it cost me to make the choice that I want to see a nurse practitioner? We have nurse practitioners working in emergencies. I thought that was an awesome idea. I jumped up and down when that happened. But my nurse practitioners who are working in those sectors say, Debbie, we have them in the wrong place because we are drawing people to emergency departments with non-urgent issues to see nurse practitioners. We need non-urgent care centers away from emergency departments and direct patients there, which frees up our emergency departments. I haven't done a cost analysis on that, whether it's cheaper to see a patient in a non-urgent care center by a nurse practitioner than the patient to be seen in an acute care emergency department like the Health Sciences Center. I would say it's probably cheaper. So let's explore utilizing nurse practitioners in even more ways than we are today. Mental health. Certainly, you know, it's come to the top of the list for everyone. Finally, we're starting to put mental health on the same page as physical health. Talk about the poor cousin. And in cost or in resources, but also in terms of stigma. And I certainly applaud the all-party report that they put out in terms of moving mental health forward. And we need to continue to put mental health initiatives and innovation forward in terms of how we deal with this very vulnerable issue and population. And I didn't know before I did research for this presentation that 20% of Canadian youth develop a mental illness by the age of 25. That's a staggering, staggering number. And we believe that, you know, an innovative way to address that issue and be proactive is to put registered nurses back in our school system. We have educators providing mental health services when they're not educated to provide mental health services. Bullying is on the increase. Substance abuse is on the increase. It is starting in elementary grades. We don't have to focus on high school anymore. We need to start focusing on elementary school children. We need to allow educators to educate. We need to allow health professionals to work in the healthcare, in the education system, so we can improve on the mental health of our youth. And if we go back to the slide that was in the package, we also have very high rates of obesity in our children and very poor nutrition. Guess what? Registered nurses can advocate and teach our children in the school system about education and obesity. Strong public health care was a question. Room for privatization. I don't think it's any surprise to anyone in this room that registered nurses do not support privatization. And I don't want another study. I don't want another conversation. Look at the reports that have come from every different province in this country about private healthcare costing more. We don't need to study it anymore. Why can't we just follow the evidence? If we can find efficiencies, let's find them in the public system and act on them. I don't want someone to come to me and say, Debbie, I can do it more efficiently privately. Well, if you can tell me about how we can find efficiencies, let's talk about it and how we can do it in the public system. Because I don't believe that people should be able to line their pockets from healthcare. I'm sorry. I believe that if there are savings to be had, it doesn't go in the private sector pockets. It goes back into our public system, back so we can provide services that we're not able to provide. I could spend a lot of time on that. Here I also want to talk about pharmacare. I took it out as a slide because I thought I'd run out of time, but several others have mentioned it, and I feel this is a must-have for us in this country. This is a national issue. It's not a provincial issue, but it affects every single one of us. It was nurses' unions who put a national pharmacare program on the agenda for a discussion. Nurses' unions who are progressive, in talking about an issue that is costing our country billions of dollars. We need a national pharmacare program. We know patients are making choices between medications and heating their homes and what they're going to eat. That is happening in our province. With the federal budget, we knew it was coming when Dr. Eric Hoskins resigned. The rumor was out there very quickly that in the federal budget they were going to announce a national pharmacare program. Nurses across this country applauded the federal government in their move. But then we saw them backtracking in terms of, well, no, we're just going to fill in gaps and whatever. Well, nurses in this country have spoken out loud, physicians have spoken out loud, others have joined our voices in saying that's not acceptable. It can't be acceptable for us, and we all need to rise up and send that message to the federal government. Research that nurses have done shows that this province will save $100 million a year by a national pharmacare program. That's just in terms of money. Just think of the unknown costs in terms of what that means for people and families who are healthier. I also just want to acknowledge seniors and aging, also a slide I put out. And we can't ignore the fact that we have an aging population, and we need targeted strategies around how we're going to support our seniors to stay in their homes, absolutely, for as long as they can. And we need to make sure that registered nurses are part of those solutions. The Home First program, rapid response teams. How can registered nurses contribute to that based on our knowledge and our level of knowledge and problem solving and decision making that we can add to that conversation? So far I've talked about just a few solutions that would get us on that path to a healthier population, down a path to a new road. It should be a nice smooth road then, with aren't very many cracks or bumps in it. But you know, we have cracks and bumps and craters, some would say, in our roads right now in our current healthcare system. And we need to address those bumps and cracks between here and there, because there's going to take us a time to get there. We can't ignore those cracks, and if we do, it'll be at all of our system's peril. I wanted to use the boat analogy too, and obviously it was on our mind, but I went with the cracks in the road. But I think we're a ship and we got to turn it around, but there's an iceberg in front of us and we got to find ways to avoid the iceberg in the meantime. I'm going to focus my next parts of my presentation. I think I'm right on time where I want to be, and what we think needs to be done in terms of nursing and the healthcare system. We believe and know more full-time registered nurses can save a lot. And the objective when investing in healthcare, and everyone has talked about, is that will be an improvement in patient outcomes. Absolutely. The focus has to be on patients. We heard the minister talk about it. I think every presenter has talked about it thus far. And overwhelming research shows that adding more registered nurses is an investment that will improve patient outcomes. And once again, this isn't the only solution. This is a solution to improving patient outcomes. More RNs and staffing properly, working in healthier work environments will improve the healthcare system and will save money in our province's budget. I know most of you in this room may have an understanding of the value that a registered nurse brings to healthcare, but I also know that some of you in this room come from an economics background, or you're public people, or from other parts of education. So I just want to take a minute to just do a quick summary of the RN value within the healthcare system. Registered nurses are prepared to independently provide care to the full range of patient conditions, from the most stable to the most critically ill. That's our full gamut, from lowest acuity to highest acuity. We're the provider that's prepared for the most complex patients, for those that are critically ill and whose conditions change very rapidly. Registered nurses care for individuals, for patients, for communities, and populations at large. And we're the only nursing provider that is able to provide nursing care when health conditions are complex and unstable. The minister mentioned this morning about scope of practice and making sure every provider practices to the full scope. And I think this is another one of the elephants in the room, and one of the things that we need to talk about as we look at the system as we move forward. And it sometimes causes people to get nervous and start to protect territory when you describe to people, what the value of a registered nurse is as compared to other providers. And no one understands that any better than me, because last week when I talked about the replacement of registered nurses with another provider, it caused a little bit of a pushback. And I understand that whenever you talk about these issues, it creates tension. But it doesn't mean that we don't talk about the issues. And we have to keep the patient as the center of those discussions. And when I talk about losing RNs or having more RNs in the system, or when RNs are replaced by anyone else, whether it be a physician, because I would fight against that too, or it be a licensed practical nurse or a personal care attendant. For me, it's about what the system loses when you take that RN out and puts another provider in. Because there is a piece of nursing that only registered nurses can do. And that is the piece where we care for the unstable, unpredictable type of patient. That is only a registered nurse's role, to provide nursing care to that group of people. When you take an RN out, I have to ask the question, who is providing that piece of care? If it's not being provided by anyone, then I would argue adamantly, based on research, then the person that loses out is the patient. And as a result, it lowers our health outcomes and it increases our cost to the system. So, to appreciate a conversation on why we need more registered nurses, I think it's important to look at our nursing numbers. And I think it was Dr. Parfrey who put a slide up about the highest per capita, our nursing RNs, the highest per capita in the country. And it's always a number that I'm always asked to defend. And I think the first slide I gave you about our geography, our unhealthy population, all that, the number of facilities we have defends that number. But I think we need to look beyond that big, broad number and look at the realities that are happening within our system. And this is a chart that we put together based on Regional Health Authority employee counts. And it looks at the period from 2003 to 2016. And as you can see, maybe the most important thing that is on that slide is the trends, in that we had an increase in RNs over time, but since 2012, our numbers have actually decreased in the last 4 years. For licensed practical nurses, the other regulated provider, you can see that they've been going downward since 2003. But the personal care numbers, the unregulated provider, has been steadily increasing so that their numbers have tripled in that period of time. You might need to contemplate on that a little bit in terms of the loss of the regulator provider in the system and the knowledge that they bring. And you also have to superimpose on those numbers is the change in acuity and complexity, the aging population over that period of time, the change in treatments, the fact that we're keeping people alive longer, the fact that the patients in ICU today would not be alive in 2003, and the patients that were in ICU in 2003 are being cared for on nursing units because that's how our system has changed. Yet, the professional, the regulated providers are decreasing in our system. The other piece that you need to superimpose on this, and just looking at the registered nurse numbers, is a change in type of employment that we've seen over the last number of years. And in fact, we have seen in the last 5 years the number of permanent full-time and part-time positions decrease by 300, but the number of casual relief positions increase by 300. So we've taken out the permanent core staff and we've increased relief staff. Is it any wonder that the number one priority of my members is workload and staffing? And it's their number one priority because it's having an impact on patients and on them, and it's having an impact on patient outcomes. Inadequate RN staffing is negatively impacting patients and is costing our province money. And there's research and evidence to show that the more time you spend with a registered nurse, the better the patient outcome. More RNs means a more efficient system. It means we're not canceling surgeries, that we have better patient outcomes, earlier interventions, we prevent complications and fewer readmissions. Because of inadequate staffing, registered nurses are burnt out. And they're expected to work while they're burnt out. They're expected to work short-staffed. They're expected to give good quality care to their patients. And we're expecting them to do that all the while that the majority of our facilities are working at 100+ occupancy rates. And we're not staffed for 100% occupancy rates. Remember, registered nurses are also saving lives while they're doing all that. They're executing decisions that have a direct and immediate impact on patients' lives. Last year, over 240,000 hours of overtime were worked by registered nurses. I haven't written down the number of unpaid overtime. This is the amount of overtime that was paid. This is the equivalent to 123 full-time positions, just in overtime alone. Patient care and procedures are being canceled. We know surgeries are being canceled because there aren't enough registered nurses. In long-term care, there can be just one RN on the nursing team for up to 80 residents. And on the night shift, that drops to one RN for 140 residents. And you have to remember, the registered nurse is the only provider in that situation who is equipped to deal with a resident in long-term care who becomes unstable. And they do become unstable because that's their home. And they get sick. They require higher level intervention. Registered nurses routinely work short-staffed, and they're still required at times to work 24-hour shifts. Last year, over 1,200 shifts were greater than 16 hours. I ask you, would you get on a plane knowing that your pilot has just worked for 16 to 24 hours? Would you find that acceptable in an airline industry? I think not. Well, we know it's not acceptable in the airline industry because they have mandated rest periods for pilots. Yet we think registered nurses can work 24 hours, and that's not going to impact patient outcomes. And our members still have to request, well, no, they request a day off 6 months in advance to go to their child's wedding, and they're told, you might have to ask the morning of to see if we can give you the day off. Is there any wonder why sick leave is high, Dr. Parfrey? Research shows that for every surgical patient added to the RN workload, the risk of patient complications and death increases by 8%. That's a staggering piece of research. With more RNs, readmissions of surgical patients may decrease by nearly 50%. With more RNs, patients who experience a cardiac arrest in hospital have a greater chance of survival. More RNs decrease falls, infections, and length of stay. All of these things have a cost associated with it. And this is just a snapshot of the nursing research that we have available to guide our decisions. $47 million was spent last year on vital overtime and sick leave for registered nurses. And I'm going to stir the pot again. Because Dr. Parfrey, when he talked about the high sick leave for registered for nursing, he said that was related to our contract. And I had to take a deep breath. I'll take one now too. Because it's not related to the sick leave in our contract. In fact, government changed the sick leave provisions in our contract a number of years ago, changing from 1 day a month, from 2 days a month to 1 day a month. And research and data that we have shows that the people who are under the new system are taking the same amount of or sick leave as the ones under the old system. We've done research with our members because we are a progressive union and we want to understand this issue because we want to have our members at work and healthy. We've done research with our members and our members tell us why they're not at work, and it is because of the workplace and the working conditions in the workplace. It is because they can't get a day off for their child's wedding 6 months in advance. And what are you going to do? Are you going to risk not being off when your daughter's getting married? No. You're going to call in sick. And that's a reality, that is what is happening. We have young people in our profession who are taking mental health days because they cannot go back and face the day tomorrow like they just had today. If we fix our workplaces, we will address the sick leave issue. But there's a certain reality around a workforce that is 95% female as well, that we cannot ignore. And that is, as females, well, as mothers, and not all are female registered nurses as mothers, but spoken as a mother and as a registered nurse. When my child was sick, the person who stayed home with my child was me, because I'm the registered nurse and I'm the one that's going to stay home. That's a reality that we have in nursing that we don't have in any other profession. And it's a reality that we need to make allowances for. It's also a reality when schools are closed. I had this conversation with a former CEO of Eastern Health, and she said, when I hear an announcement that schools are closed, I know my sick leave is going to go up. It's a correlation. And she said, because they have nowhere to bring their children, Debbie. What do I expect them to leave their children home with no one to look after them? And I said, no. She said, well, why can't we start having conversations about daycare for health institutions? Because that is costing us money. It's not about attacking people because they're using sick leave. It's because we don't have the other supports to support people so that they don't have to use sick leave in order to care for themselves and their family. 300 surgeries, so that's my little rant on sick leave. 300 surgeries and procedures were canceled in Eastern Health last year due to RN shortages. Significant cost on the system. All of this costs the system money. With a standard hospital stay in Newfoundland and Labrador at $6,000. What? Oh my goodness, it's not true. Oh, I wasn't watching the time. Okay, I'm going to run over this. So you can see the cost there, how high it is. So for everything we prevent, this is the money that we save. This is why we need more full-time RNs. I'm not going to spend a whole lot of time now going over this slide. Our solution is about investing in registered nurses so that we can save money. I will take 20 seconds to acknowledge government for moving forward with a workforce management system, which will improve, hopefully, scheduling. I'll also acknowledge that they listened to registered nurses when we brought to them that we'd also need to integrate a staffing system based on patient acuity. We can no longer staff our facilities based on budgets and based on beds. We have to staff based on the needs of the patients in the beds so that we improve outcomes. And I want to finish off by saying, I've talked a lot about how RNs can save patients and how we can save money, but we also need to look on how safe staffing can save RNs. And I want to take a minute. Can I do it? Okay, 30 seconds. All right. So we can't fix healthcare without addressing what I call the broken providers. And I believe we need to listen to the voices of registered nurses and others. I only hear the voices of registered nurses because that's who I represent. But I do want to read you the voices of some of my members. I've been a registered nurse for 24 years. I'm at a crossroads. I have 12 years left until I can get my pension, and I simply don't know if I can last that long. I am mentally spent. I am physically spent. I question if it is work that is going to break me. How sad that makes me. How angry that makes me. Another comment. As a new grad of 2016, I am dismayed by the number of 16 and 24-hour shifts worked by myself and my coworkers since my hire. It is hard to go to work not knowing when you will go home. A physically and mentally exhausted registered nurse is not fair to our patients. They deserve the best version of us. And finally, I enjoy what I do. The the patients, the residents. They give me joy in my day. I try hard not to show my fatigue. I hope they do not see it or that they see my tank is empty. I fear for my safety, my health, and the health and safety of our patients, residents, and communities. The broken system has broken me. More full-time RNs can save a lot. Thank you, and I'll take your questions.
Okay, thank you, Ms. Forward. Questions from the audience? Can you
Yeah,
just
you need
wait
a
for the
microphone
mic,
in.
please? Sorry.
And Kearney School of Nursing. I just want to speak about nursing attrition. Significant number of nurses, registered nurses, plan to leave the profession within the first year. They go out into the workforce. They are completely disillusioned. They are overwhelmed with the working conditions, and we need to speak more about that publicly, about the conditions that nurses work in. You mentioned the 95% female workforce, that there are greater impacts on registered nurses because of that, because of gender issues. My daughter is a registered nurse. She routinely works at least an hour overtime unpaid most days, sometimes 2 and 3 hours. This is not spoken about. You know, and as you said, the patient outcomes related to the burnout, and then the lack of understanding by other healthcare providers where nurses fall in the hierarchy, and there is a hierarchy, how we are treated in the healthcare system. We need to discuss that.
If I could comment just a minute about the nursing attrition, and I don't have the number with me, but nationally it's been looked at in terms of the numbers who are looking to leave the profession in the first 5 years, and those numbers are very, very high, and it is focused on the workplace and the working conditions. I mentioned in the slide about the numbers in terms of the increase in the number of casual RNs. We're now over, in this province, over 1,000 casual RNs employed. One of the reasons for that high number is because new graduates can't get permanent jobs that their employers are hiring now as casual. But the other trend that we're seeing, which I think we need to have more research on, and one of the things that's being looked at is that people are choosing to work casual because of the workplace. They're choosing to work casual because they can refuse a shift, that they will not go to work and work full-time and be at the beck and call of employers, that they don't know when they're going to go home when they go to work at the start of the day. On their day off, they're called and asked to work overtime. And if they refuse and say, I don't, they're forced to work overtime. Whereas the casual workforce can say, I'm not going to work. The employer doesn't have them until they actually enter the doors of the facility. We have registered nurses who won't go into hospitals for meetings because they feel they might be nabbed by their supervisor to work. That is a sad situation. And Anne is right, it is driving people out of the workforce, but it's also creating challenges for employers. With a casual workforce, if you don't have your shifts filled for your core staff, so on a surgery unit, if you need 5 RNs to work every shift in order to provide care, if you can't guarantee that you have those positions filled with permanent people, and you're dependent on casuals to say, I'm going to work today or I'm not, then you can see how that's impacting the ability for employers to staff their units. That is a concern for every single one of us in this room. We can't keep driving our workforce to casual, because if we do, we're at very, very vulnerable of having core staff to provide nursing care when we need it.
question up here at the front with Dr. Parfrey. And then we've got a few more. I think it's
You're good now.
I don't really want to make the issue of overtime and absenteeism a big issue. You can interpret it in various ways. The reality is there is an entitlement written in the contract. That's all I would say. And the cost of it is 45 million. So in the big picture, it's peanuts. So what I would really like to know is you're a union leader, and the iceberg is approaching, and we've a limited budget. It's not going to go up, and your presentation says that we need to spend more money on our ends, right? So you're asking, in effect, you want more money. So could you visualize yourself as a union leader dealing with the stakeholders to come up with a long-term 10-year plan to try and fix our healthcare system?
RNU has always been wanting to be a part of the conversation for a long-term healthcare plan. And we have, coming together as stakeholders is not new to this province. We did it back in 1997 or whatever, ish, where all the healthcare stakeholders got in a room. I was president, believe it or not, I was president at the time. And we all took our hats off at the door and we had some discussion. And actually coming out of that discussion is where the nurse practitioner initiative came from. From that discussion, there was a consensus in the room that this was one way that we can start to address the poor outcomes and the fiscal realities of the healthcare system. We were part of that discussion as a union, and we would welcome any opportunity to be part of those discussions. We have put forward one solution to government. We believe we are spending money by not having enough registered nurses in the system. We are not picking up on complications. We do not have the registered nurse knowledge in the system to pick up on those things that are costing, to prevent the readmissions, to stop the surgeries from being cancelled. We believe in investing in registered nurses will save the system money. It will save on overtime, it will save on sick leave, it will save on a registered nurse saying, I can't work in this unit anymore, I'm going to work here. And research shows to orientate someone new costs $25,000. People are moving around because they cannot stand the workload on a particular unit. If we have a stable staff, RNU, is a leader in healthcare. This is my opinion. It's my members' opinion. We are a leader in healthcare in this province and in this country. We see the challenges around RN staffing. We took the initiative by saying to our national counterparts, we need to look at nursing staffing models in other parts of the country and the world. I went to New Zealand to look at their staffing model. I brought that information back to government. They are looking at a model where we can hopefully move towards staffing based on needs of the patient in the bed. We are not staffing based on that now. We have led that led that discussion, knowing full well that that is risky. It's risky for our members. It's because it doesn't mean that at the end of the day, the staffing on every unit will be the same as it is today. It doesn't mean it might be the same provider. But it is about workloads, reasonable workloads, and the right staffing to give the best outcome for the patient. So we take risks every day and go out on a limb in terms of doing things that are going to improve health care. Because you know what? If we improve the health care of patients, we also improve registered nurses' health, and we improve their ability to give health care, because one goes with the other. You can't, if you don't have healthy registered nurses and numbers to provide health care, we're not going to have healthy and good outcomes for patients. We go hand in hand.
Okay, we've got a number of hands up.
I have
Oh, you've got the mic.
I have a mic here.
So we've
yeah.
only got 4 minutes left. So
Okay, very quickly.
Short answer, I promise.
Power shapes behavior. Public policy is a choice to produce or affect good behavior and to avoid bad behavior. We're in a period of policy failure and perhaps even political crises. And I think the critical question is, are the various kind of interests or the players collaborating more or competing more? So in a sense, is it worse in terms of getting transformation? We often think transformation will just occur when we have or experience policy failure and political crises, but that isn't necessarily the case if the competition increases and there isn't kind of an effort or behavior which is collaborative. So I guess my question is, are we in a state of crises in a position where the various actors are more competitive, or are we seeing more efforts to collaborate across systems?
That's a tough one to answer. I can't say there's more competition, but I don't believe there's enough collaboration, I guess. Getting the right people engaged in the conversations is critical. I don't feel that is currently happening, and I think it's not happening from the top down. I believe it starts with a government. It has to start with the highest level of leadership to show where we're conversing and engaging. I can't remember the last time a Minister of Health called me in and say, let's have a conversation about something, unless it was some type of structured form, but we're not routinely included in conversations of that, in terms of like, let's just get together and have a conversation versus, trying to get a yearly meeting and bring your list, right, of trying to get your issues forward versus, I guess, so I think it has to start from here to make sure people are driving this way. And, if I report and say to my members, we're included in conversations, they're more likely than for them to say, okay, let's us be included in conversations as we go down. If I go to my members and say, we weren't part of the discussion, then unfortunately, things shut down. People are just disillusioned with that. And they feel not heard or considered. So we have a lot of work to do around bringing more people into the discussion.
And I think that's a great point to stop on. That's what today is kind of about, and we hope we get there. So we're going to break for lunch. Thank you again, Ms. Forward, for that.